Hi class, welcome back. Today we'll be discussing Chapter 5, Section 5. My name is Dr. Paron. The topic of today's lecture is sensory and perceptual development taking in the world. So some important terms as we start this lecture. First is sensations. This is the stimulation of sensory organs such as eyes, ears, and skin, and the transmission of sensory information from them to the brain. Example, when a baby feels something soft within its fingers, maybe a blanket. Perceptions is the next term. So the process by which sensations are organized into a map of the world for them. So an example of this would be how a baby's brain processes the categorized information of the soft blanket after they touch it. So we're going to talk about the development of vision. So this includes development of sharpness of vision. This also includes development of peripheral vision. Newborns are very, very nearsighted, with them starting with a vision of 20/600. The greatest increase in vision quality is 6 months. At 6 months of age, where their vision becomes 20/50. Between ages 3 and 5 years of age, vision actually becomes closest to how it will be in adulthood. In the best cases, in the hopeful case, it'll be 20/20 vision, which is perfect vision. Babies will also have very poor peripheral vision. So some visual preferences of infants. So in 1975, there was a study about visual preferences that infants have. It was actually found that they preferred to look at lines longer than they looked at blobs. They also had more of an interest in looking at curved lines to straight lines when they were given a choice when they were ages 8 through 12 weeks old. And infants in this study also showed distinct interest in the human face due to the curved and contoured lines, differing shapes, and circles as eyes. Infants learn quickly. They most definitely do. So within hours of birth, over the days that follow the birth, the infant can discriminate their own mother from her face from that of a stranger. By 3 to 5 months of age, infants can tell the difference between different facial expressions. Starting at 2 months, infants can actually prefer attractive faces to unattractive counterparts. And babies often focus on their attention on outside edge of items. So next we're going to talk about depth perception. So infants develop the ability to have depth perception and depth cues by the time they're able to crawl. For most of them, this is between 6 to 8 months of age. There was a cool experiment conducted where an infant was called and gestured to crawl across a sheet of carpet. But what they didn't realize is that the carpet ended and was replaced with a clear piece of glass in front of the woman calling the baby to crawl to her. This simulated a cliff in the way that the baby thought there was nothing there to crawl onto. So most babies would stop at the edge of this carpet, fearing that they were on the edge and they would fall. This is an example from the textbook about the cliff experiment. So as you can see, the carpet ends and the same design is underneath so they can see it through, but it actually is a sheet of glass, so they feel as though there's nowhere to go. So the development of hearing. So babies move their hands in the direction of sounds pretty early on that they can hear. Sensitivity to sound increases in the first few months of the infant's life. So the ability to detect pitch and loudness gets better through the preschool years, as opposed to being an infant. Infants have acute hearing, however, many wake suddenly from naps from even the smallest of sounds. Infants also that were exposed to background noise become used to them and awoke from naps less frequently. So it is encouraged for babies when they are brought home from the hospital to be around louder sounds like the TV, the vacuum, dogs barking, just normal sounds that they will get used to. The next definition we're going to cover is habituation. This is a process in which one becomes used to repeated stimulus and therefore pays less attention to it, like we were talking about with the different sounds, maybe the TV, the vacuum, the dog. Infants know the sound of their parents' voice, both of their parents, at 3.5 months of age. So now we're going to talk about the development of coordination. Babies will turn their heads to look towards unpleasant odors and sounds. In doing so, they increase their visual and scanning abilities. Infants tend to look for longer periods of time at items that differ from what they're used to seeing in their natural environment commonly. So if something looks different or unusual to them, they'll be interested and look for longer durations of time. So do children play an active or passive role in perceptual development? This is a really good question. So newborns have a very sophisticated sensory capability. Their new view of the world is very mechanical in nature or very passive. Stimuli often captures the infant's attention, but infants are at the mercy of their environment, meaning that when they're exposed to is what they directly react to. So a developmental psychologist named Eleanor Gibson actually made note of many changes in development. She gave 4. 1, intentional action replaces capture. 2, systematic search replaces unsystematic search. 3, attention becomes selective. And 4, irrelevant information becomes ignored. So what is the evidence of the role of nature versus nurture in perceptual development, you might wonder? So evidence supports that infants are born with sensory capabilities, and this aids their perceptual development as it increases. Evidence also supports the experience plays a large role in perceptual development for children. And lastly, children have critical periods in their development. So if they're not given exposure to sensory stimulation at the time, they may be at risk for deficits that may be permanent if intervention is not taken. And that is the end of chapter 5. I will see you all in chapter 6.